You're watching World Insight with me, Tian Wei. Still to come on our program. A tuberculosis outbreak in middle school in Hunan has gripped the nation of China. Can the world succeed in eradicating this disease? Welcome back. You're still watching World Insight with me, Tian Wei, coming to you Monday to Friday on CGTN. Tuberculosis outbreaks in Hunan has gripped public attention in China. Local authorities for discipline inspection are investigating, and some officials who hold the responsibility to the incident have already been fired. Take a look at what exactly happened.
We hear nightmares, one after another, and every day our classmates are sent to hospital. Nobody can understand the pain that we've suffered. We lag behind in our studies, and to lead a normal life has become a luxury for us. Those are the words from the diary of a tuberculosis patient, a student in her final at Taojiang No. 4 Middle School in Hunan Province. Her dream of entering a university this year seems beyond reach. As of last Thursday, 29 students at Taojiang have been diagnosed with tuberculosis, and there are 5 more suspected cases. A total of 72 students have received treatment or been put under observation, including 38 who've been given preventative medication. According to the local government, the outbreak started from August 19th, but no exact number of infected students was released. But some students claim there'd been cases of tuberculosis at school before then, and they've accused the school of hiding this information and not taking measures. The headmaster later responded that on the one hand, the local Center for Disease Prevention and Control hadn't asked the school to stop classes, and on the other hand, sending all students home would make it difficult to monitor the disease. The local government says 25 of the students are in the same class, and all those infected are expected to take the National College entrance exam soon. Tuberculosis is an infectious disease that generally affects the lungs. Experts say it takes at least 6 months to recover. So far, 50 students have recovered and been pronounced fit to resume study. The remaining 22 must undergo regular checkups until they're given a clean bill of health. Provincial authorities for discipline inspection are investigating whether there was dereliction of duty or misconduct by civil servants in the matter.
And for more on the tuberculosis outbreaks in central China's Hunan province, we are joined in our Beijing studio, Dr. Fabio Scano. Welcome back to our program, Coordinator for Disease Control and Prevention at WHO China Office. In Paris, we are joined by Dr. Eric Ding, epidemiologist and health economist from Harvard School of Public Health. I want to welcome both of you. First of all, Dr. Scano, how did it happen and why? Not just one outbreak, but 2 outbreaks, according to the latest report already.
Let me put it in perspective. The pillar of tuberculosis control is early diagnosis and to put patients on treatment as soon as possible. And to immediately screen what are the contacts. Basically are the people who came in contact with the cases. It's very basic. What we know about this outbreak is that there is an investigation ongoing that is looking not only into the outbreak but also into the response. And it's from various government, national authorities, government agencies. We are confident that the results of the investigation will inform the future step, in the sense that the system needs also to learn from itself on what action needs to be taken in the future for not having this happening again.
Of course, we're looking for the results of the investigation, whether who is responsible, how they spread, and why they spread so fast, because we also understand, besides the middle school that has been reported in our earlier backgrounder, there's another outbreak of more students coming from the vocational school in the same province that has been firmly already confirmed. Dr. Ding, while you were listening to the outbreaks in Hunan province, what came to your mind as an epidemiologist, and what do you think might be the common causes that has led to where we are today?
Yeah, I think tuberculosis is something that's very difficult to, at first, for regular non-clinicians to recognize, even for clinicians to recognize, especially since coughing is very common in the wintertime, you know, pollution and lots of other diseases and conditions give similar early signals of the same symptoms. So it's very hard to find, and especially in the rural villages, there's some studies that show only 5% to 1/3 of villages actually correctly diagnose TB and manage them, even if you do go to a clinic or doctor. So I think the management and early detection is very, very difficult, especially since most people ignore it, and especially among young people who don't want to take time off from school to prepare for their gall call.
Then, Dr. Scano, the question to be asked is, we've already got 2 outbreaks. Whether there's likely to be more outbreaks in that province or in the surrounding areas, it's a big concern. What is the way to prevent, and what is the way to know?
Well, I think that this case has brought attention to tuberculosis and to outbreaks of tuberculosis in settings like schools or also prisons, what is called congregate setting. And outbreaks per se, or cases of TB in school, are not unusual. I'm from Italy. When I was 16 in high school, there was a case of TB in my school. Everybody was screened. Fortunately, nobody felt sick. The patient, the student, was put on treatment and then came back to school. So it's really a multi-sectorial response to look into the situation and keep the alert always high, because it can happen also everywhere. But the issue is, what is the response? And I think that this is a lesson learned for the future.
And whether the response is speedy enough.
And whether the response is speedy enough.
Exactly. Dr. Ding, of course, the outbreaks of tuberculosis really ring a bell to many people, alarm, shall I say, because people still remember very clearly about the SARS outbreak in China almost a decade ago now. And yet that has left people with a lot of concerns at the time. So the question is, how can the health system always improve itself? Not about being cautious about one outbreak, but always on alert. That's exactly the role of the CDC, many would argue. So, Dr. Ding, what is the way to do it?
I think people, first of all, have to be proactive in trying to identify these symptoms and conditions, and not be afraid to shut down entire schools if necessary, because oftentimes local principals and even local hospitals are hesitant to create a quarantine or to create a mass scare because of economic interests or other political interests. But I think in public health, people should be rewarded. That says, even if you raise the early alarm bell and it's false alarm, that's actually better than not raising any alarm and creating an epidemic. And so I think we have to change the culture, because people right now, they don't really even, doctors in these rural villages, they don't even correctly prescribe the right antibiotic medicine. They don't correctly order chest x-ray. I think people need to realize public health priority is way more important than a gall call exam, way more important than economic interests. And if we put public health and quarantine and mass testing priority first, I think we can control it and not have another outbreak every few years.
That's true. Dr. Scano, there's another issue that people have been asking, that is, what about the drugs that's needed for the treatment of tuberculosis? There have been some media reports suggesting some of the low-cost drugs have not been popular with manufacturers. Rather, only the imported ones, which are tending to be more expensive, or some of the more expensive local-made drugs. Dr. Scano, what do you make of the latest situation regarding that to treat tuberculosis?
I think that to treat tuberculosis, there are the right drugs, and it's a paramount importance for the doctors to follow the standardized guidelines that are issued by the government and not taking necessarily individual choices. Because what really worked for TB around the world and in China since the 90s is a standardized treatment approach. In fact, over the last 20 years, the rates of tuberculosis have been coming down in the country, and the situation is much better than what it used to be 20 years ago. If we start misusing the drugs, the result is multi-drug resistant tuberculosis. That is much more difficult to treat, and it's a much bigger burden not only on the patients but also on their families. So really a lot of attention and also guidance is on following standardized treatment.
Dr. Ding, as you can see from Dr. Scano's explanation, China has very clearly have guidelines regarding how to prevent and treat tuberculosis. And yet, in an outbreak like this, people are still getting very concerned. In terms of the drugs,
well,
what do you think the way?
Guidelines. Yeah, I think the drugs, first of all, 1/3 of all multi-drug resistant TB occurs in China. 1/3 of all the multi-drug resistant TB in the world occur in China. And that's an incredible amount. And if you actually test the doctors on surveys, they prescribe correctly on the survey tests. But in the actual practice, in some of these studies, in these rural villages, people give out, unrelated, drugs like candy. And so I think it's not just making sure having the correct guidelines, but making sure you enforce these guidelines at the local level to not have more multi-drug resistant TB, because those are the most dangerous TB. And if multi-drug resistant TB gets out, it's almost impossible to stop.
All over the world, gentlemen, we have 900,000 outbreaks. This is a disease that can be, in a way, prevented and also can certainly be treated after all. How long are we going to see this disease still continue, particularly in developing countries and emerging economies? There are enormous amount of efforts made all over the world to eradicate it. However, it is still there. Dr. Scano.
You're right. It actually has been with humanity for thousands of years. What is a good news, I think, is that we should share with the public is that last week there's been one of the highest political commitment for tuberculosis, and President Putin opened a meeting, a ministerial meeting in Moscow, specific on tuberculosis with the leadership around the world, and we are happy that also the Minister of Health from China attended the meeting, and ended up with a Moscow Declaration that is a bold multi-sectorial response to end TB by 2030. So there is a target, and what is needed is really a political commitment to end the last miles of this marathon, to really end TB in the world.
Dr. Ding, is that last mile easy?
It's not easy at all, because the solution to TB is not just quarantine, not just drugs, but actually better nutrition. And better nutrition is basically a measure of economic development. And micronutrient deficiency, which occurs not just in Africa, in India, but also in China, in rural villages, I think that's actually one of the most important fundamental things. You cannot just use drugs and use quarantine to solve TB. You actually have to solve the entire healthcare ecosystem, starting with nutrition.
We see China's economy has been taking off, gentlemen. We see the lives of people and the living standards have really been improved. And yet, some of the long-stay disease that's suffered by the public in a much worse economic situation are still with the Chinese public these days. Dr. Scano, you've been here in China for really quite some time. How do you make of this division that we seem to have, or conflict in a way, that Chinese President Xi Jinping was even talking about at the 19th Party Congress, the demand for better life from the public and the insufficient and unbalanced development of the country. How much is that need to be done in order to get rid of tuberculosis? And that is only one of those examples regarding health. Dr. Scano.
I think that the challenge and the goal of the health reform, that is one of the biggest program of any government in the world, is exactly to bring care to everybody in China, not only in the major cities, but in every corner. TB is a problem in China, but if you look at the numbers per population, they're not so high, because there is a lot of inequities between urban and rural areas. So, since there is a lot of emphasis on the health reform, it would be very good if also tuberculosis, which is in every corner of the country, could benefit from more investment in patients accessing care without shouldering also financial hardship. That is another issue that is linked with tuberculosis.
Dr. Ding, agree with that?
Absolutely agree, but I think the overall picture is more economic development, and not just pure economic development for money and economy and factory's sake, but actually health care and correct delivery of nutrition to these rural villages, where that's actually where a lot of these epidemics start, not in the urban cities. So I think more of the focus on the inequality and more of the whole economy development, not just building more factories and chasing economics per se.
Dr. Scano, it is not the first time that you see that some of the officials in charge or related to health scares actually are being held responsible. This time too, some have already been fired or sacked at the moment. But will this be the ultimate way to make sure that system would work well and work as it plans to be?
I think what is important is that the system learns from itself on the response. Then I don't comment directly on whether a person should be removed from the seat or not, because this is a part of the national authority's responsibility. But what's really crucial is to understand not only what worked and what didn't work, but also how to communicate the results to the population, because what we are seeing now is to associate TB with stigma and discrimination. And this goes against a public health approach, because people, they don't access care or diagnosis because they are concerned about being stigmatized. And this plays really against what we want, that is people accessing the health services if they need it.
Dr. Ding?
I think firing government officials and schools teachers is not the solution. You need, as we know, carrots work better than sticks. So I think what we should actually have is perhaps a reward system for those who report early cases, that even if it's false positive, I think having this carrot approach is way more better than using the stick approach of trying to scare and fire people who do not adhere afterwards, after an epidemic happens.
Well,
so I think prevention and proactivism is key.
Probably carrots and sticks both has to be used. But for now, I want to thank both of you, Fabio Scano and Eric Ding, for being with us. All the best to the children in the middle school, in some of the schools that have experienced outbreaks. And that is all the time we have for today. If you'd like to see more, try to find us World Insight CGTN into your search engine, or check out our YouTube channel. You can also follow us on Twitter, Facebook, and Sina Weibo. From me, Tian Wei, and everyone on the World Insight team, thanks for watching. Tune in again next time for insights across China and around the world. Good night.